next question, which is considered to be one of the simplest question could have ever been asked in orthopedics, because this is the era where the practical questions are very frequently asked. Okay, that the lateral rotation of the cervical spine occurs at which level? We know that in the cervical spine there are 7 vertebral bodies, C1, 2, 3, 4, 5 and 6 and 7 vertebral bodies are there. There are some specific movements which occur at C1 and 2 and another specific movement which occurs at the occipito-atlantic junctions. You know, the first cervical vertebrae is known by the name of Atlas. Why is it called by the name of Atlas? Because of the Greek mythology. Like if this is the earth and Atlas is holding the earth, and if you recognize, if you remember that Atlas at the time of bearing the weight of the entire earth is bending the neck forward, that means the yes movement is bending the neck forward, no movement is lateral deviations. So the yes movement occurs at the junction of occiput and Atlas, that is for yes. That means forward movement or the forward flexion, also known as nodding, that is N-O-D-D-I-N-G, that is nodding. On the other hand, you know, the second vertebral body is known by the name of axis, and the importance of axis is that in its structure, if you look at the superior inferior structure to the axis, that in the center there is a odontoid process, and this odontoid process, it articulates with the anterior wedge of the atlas superiorly, and at this junction, suppose this is the odontoid process of the axis and this is the anterior wedge of the atlas, and at this junction this rotation happens, and this rotation is responsible for the movement of the neck in the lateral directions, that is lateral deviations. And we do represent the word no by this movement of the neck. So no is being carried out at, that means lateral rotation of the cervical spine occurs at the level of, this lateral rotation of the cervical spine occurs at the level of the atlas and axis. As far as C6, C5, C7, rest of the vertebral bodies in the cervical vertebrae are concerned, they are responsible for bringing about the movement collectively in the form of forward flexion, then extension, that means hyperextension, and the lateral bendings. But this lateral rotation typically occurs at the level of atlas and axis, having fused with the occiput and the atlas are joined together, and this rotatory movements occur at the level of atlas and the axis. The next question is, before we start discussing the next question, it is extremely important to emphasize that what is the practical significance of this question that every student should understand. For the last 5 years, continuously in the patterns of both NEET as well as AIMS or in PGI in particular, the question related to the infections of bone are continuously being asked. They have started with asking about the chronic osteomyelitis, after that the acute suppurative osteomyelitis, and now they are asking about the Brody abscess. Now, as far as the language of the question is concerned, it is relatively simpler, that pain in the right knee for the last 2 months, occasional fever, localized tenderness, what is the diagnosis? Before we try to understand or locate with the answer, we need to understand the pathophysiological mechanism behind the infections of the bone. Now, this is a kind of the concept which is not a newer one for all of us, that a bone has got certain regions in the form of the epiphysis, then metaphysis and a diaphysis. And it is the metaphyseal region which is the most common site to be affected by any infection. So there is an infective organism which is affecting the metaphysis, and the infective organism tends to grow both in location as well as in the encroachments. This growth is usually limited by the periosteum, that is the cambium layer of the periosteum. It tries to encase the growth or limit the growth of the organism, but because the organism is virulent or fulminant enough, it breaches this periosteal wall. So there is another attempt by the periosteum to encase the organism. It is breached again and there will be a periosteal reaction again. So it all is based upon the virulence of the organism. If the organism is virulent enough, or if the host is immunocompromised, then it favors the growth of the organism beyond the boundaries of the, or beyond the walls of the normal bone. This is the feature of acute osteomyelitis. So what are the key terms that we have to hear in case of acute osteomyelitis, or which points towards the diagnosis of acute osteomyelitis. One is the periosteal reaction, and another one is the loss of soft tissue planes. Soft tissue planes, because nowadays the x-rays which are used are digital x-rays, where the planes of the soft tissue, as far as the separation from the bone to the inner soft tissue is concerned, and in between the two compartments, that means from the outer to the inner compartment is concerned, there is a plane of difference. If there is a collection of the abscess in between, then that soft tissue plane is also lost. So these are the two key terms for reaching the diagnosis of acute osteomyelitis. As far as chronic osteomyelitis is concerned, you see, if the organism continues to grow inside the bone, or if there is a ill-treated acute osteomyelitis resulting in some organism left inside the bone which tends to grow collectively around some region or some piece of the bone, so it interferes with the nutritional supply to that region of the bone, as a result of which that region of the bone becomes dead and it becomes sclerotic. This sclerotic zone of the bone, or the dead region of the bone, which is surrounded by the organism and a reactionary granulation tissue, is known by the name of sequestrum. So what we are talking about are the key terms of chronic osteomyelitis that will lead to the diagnosis of chronic osteomyelitis. What we have to look for, one is the sequestrum. Now sequestrum is a dead bone which is surrounded by granulation or the organism. If some amount of the organism is still persistent, then it will be surrounded by the organism also. Another reactionary bone formation is there which is normal in order to contain all these infective granulation tissue, which is known by the name of involucrum. So this is another key term that will make you lead to the diagnosis of chronic osteomyelitis. So one is sequestrum, other one is involucrum. And as you know that if this organism continues to grow, then it will create a hole or a fenestration in this involucral wall, which is known by the name of cloacae, and this cloacae will continue up to the level of skin, where there is a formation of tract in the form of a sinus. So these four are the key terms leading you towards the diagnosis of chronic osteomyelitis. Remember, one is sequestrum, other one is involucrum, the third one is cloacae, and the fourth one is sinus. Next, now imagine if there is a bone of an immunocompetent host. That means the individual is healthy, the individual is immunocompetent. Or the second possibility is that the organism is less virulent. The second possibility is that the organism is relatively less virulent. Now in this scenario, what will happen, that if this site is affected by the organism and there is a reactionary periosteal reaction which is trying to encass the margins of or the growth of this organism, can be successfully contained inside this bony wall, and this bony wall will be sclerotic. Bony wall or a cavity which is containing the abscess successfully, not leading to the expansion of this kind of the abscess. Now is it going to be called as acute or relatively less fulminant compared to the acute? So it will be less fulminant. Less fulminant means sub. So this comes under the category of being subacute. So this is subacute osteomyelitis. Okay, so this is the third category. And finally, a somewhat different kind of the osteomyelitis, where a diaphysis, this is another key term. We are talking about the Gary's sclerosing osteomyelitis, where the diaphysis is usually involved. You see, it is different from rest of the other kind of the infective conditions, where metaphysis was most commonly affected. Here diaphysis is more commonly affected. Second, there is no abscess formation, be it acute osteomyelitis, chronic osteomyelitis, or subacute osteomyelitis. There is a formation of the abscess, but in this case there is no abscess formation. And finally, there is only a sclerotic zone, a small zone of the bone which is infected and it is responsible for the pain. So this is the kind of the condition which is known by the name of Gary's sclerosing osteomyelitis. So these are the four categorization of the suppurative or infective conditions of the bone. Now if we go back to the questions, what they were asking is that the pain in the right knee for the last 2 months. You see, for the last 2 months, 2 months is a long duration of the course. Now it is a relative kind of the intermediate duration where it is neither too acute nor too chronic. So it cannot be a chronic kind of the osteomyelitis, because in case of chronic osteomyelitis, the duration has to be very short. It has to be in several days, it has to be in several hours. And in case of chronic, in order to be called as a chronic osteomyelitis, it has to be a duration of several months, like 6 months or so on. Then occasional fever, another condition or the complaint which is not going in the favor of acute osteomyelitis, because in acute conditions the patient is toxic, who is having fever throughout. Localized tenderness, it is pointing towards that there could be a possibility of the formation of the abscess. Now, and aiding all these conditions, there is a X-ray which is provided to you. Now in this X-ray, there is a sclerotic rim of the bone, and inside this sclerotic rim there is or there might be a collection of the abscess. If we go with the Gary's sclerosing, no, it is not Gary's, as we have seen that it is a diaphyseal involvement, there is no abscess formation. Those were the keywords. As far as acute suppurative osteomyelitis is concerned, the keywords were periosteal reaction and loss of soft tissue planes. As far as chronic osteomyelitis is concerned, what we have discussed is that there is a presence of sequestrum, involucrum, the cloacae or the sinus. So neither of these terminologies have been used inside the question. So what we are left with is the Brody abscess. So nowadays is a trend that Brody abscess has been asked and probably will be asked in nearest of the future. One more controversy which has been very fairly being created nowadays. Now this is something beyond this concept of this question, like chronic osteomyelitis. You see, subacute osteomyelitis is also known by the name of Brody abscess. Chronic osteomyelitis or acute osteomyelitis, if we have to choose in between the two, that which one is relatively closer to be called by the name of subacute, so answer is going to be chronic osteomyelitis. Why? Because acute is going to be fulminant, chronic is relatively less fulminant because it is having less organism, it is having an indolent, a long duration of the course to be called by the name of chronic osteomyelitis. The controversy was created in the AIMS examination around 4 years back when they have asked that which of the following is called by the name of Brody abscess, and subacute osteomyelitis was not there in the option. Among the option there was chronic, acute, sclerosing and acute on chronic. So better answer to be used in those scenario will be chronic osteomyelitis. So it is nearer to chronic osteomyelitis. But if you are having an option of being called it as subacute, then Brody abscess is subacute osteomyelitis. Thank you very much for listening. Hope you get to know the concepts related to the questions which were asked. It is mandatory to be told that nowadays the questions are not like that you can mug up the one-liners and answer them accordingly. The question pattern has been changing, it has been evolving in the form of being more practical, more explorative, as well as the kind of the concepts which are required for understanding and marking the answers for that particular ask. For rest of the questions, please refer to my next video. Thank you so much and all the best.